Hi everyone, today we are talking about exercise, water and food. Mostly post-delivery, post-surgery, it applies for everyone. And the first thing we talk about is exercise. How soon should you start exercise? I would say how soon should you start moving, because exercise is of different levels. So the moment you're able to control your body, let's say you had anesthesia, be it half or full or whatever was done, as long as you're out of that control and you're able now to control your body, you should start moving. So most patients, they don't like that. So they would rather reduce their water intake to reduce the trips they have to go to the washrooms. They would rather maintain like the urine catheter in place. But the best thing you can do as a patient, because it's your responsibility, is to try as much as possible to move the soonest is safe. So the moment you're told it's safe to walk, just have someone hold you, try to practice and be able to walk. The moment you're told that now it's okay, you can sit up, you can move around, take a lot of water, keep going to the washroom and back. If you're able to move, dispose your diaper, let's say inside that bin, just do them. They're those basic things that you can do as a patient, and they're helping you to move around. Another thing that we need to understand is that in exercise, unless you have a fracture where the bone you've been told is to be non-weight bearing, meaning it's not supposed to bear any weight, then if it's not that case, then you should be able to move, unless you're told not to move, or unless you're told not to step on that part of the body. That's what we need to understand. And even when you're discharged home, just try to do the basic things, just basic things. Like if you've fed and you need to maybe take your plate to the sink, simple things. Not like sitting and being like, pass me that and pass me this and help me do this, and you just sleeping all the time. So this is just a way to keep your body active, and that is the best way to heal. There are those who say there's a lot of pain. Yes, there are so many medications that we give to help you to be well pain controlled. You don't need to be pain free, because again you need to remember that you have a wound to take care of. So we just maintain the pain in a level that you can function, but still you have to like continue and reduce the pain medications with time until you now feel comfortable without the medicines. And once you're able to stay without the medicines, it's upon you again to try and tolerate some slight pain and maintain the exercise, the movement as much as it is tolerated. So we graduate gradually. So for any, unless it's a fracture, unless you've been told not to step on that foot or not to step on that hand, you should be able to move. On food, we usually say half a plate should be vegetables, a quarter of that plate should be carbohydrates, and a quarter should be proteins. And in between these meals, if you usually take 2 meals a day, 3 meals a day, then you should take a lot of water. We actually advise 2 liters of water per day for females, 2.5 for males. But the moment you're pregnant, of course, your veins expand, your arteries expand, and you need to take more water to sustain your pressure. So some people will realize that when they're pregnant, they're feeling faint. It's not really about anger, it's more of thirst. If you take a lot of water, you're able to keep your pressure up and you're able to sustain that pregnancy without feeling dizzy. Same thing happens after breastfeeding. Some people after breastfeeding, they feel like they're going to faint. It's not anger, it's thirst. So just take a lot of water. A baby alone takes like 600 mils to 900 mils of fluid from you in terms of breastfeeding. So that's the much you need to increase when you're breastfeeding. Another thing that we need to remember about water is that if you don't take a lot of water, you're going to have dry lips, dry skin, dry poop, which you need to avoid. And the more you take, the better. When we're talking about exercise post-surgery, it is important because of muscle cramps. Now, you know that for a during pregnancy, of course, we said you need to keep moving, but there are postures that you have to maintain when you're pregnant. For example, we say try as much as possible to sit upright, Try as much as possible to sleep on your side. You're not supposed to sleep on the back. And then the moment you deliver, you're supposed to maintain a posture straight when you are sitting, maybe breastfeeding or just sitting. You need to sit with your back straight. And when you're lying, you can lie on the back. If you didn't have surgery, you can lie on your stomach. You had surgery, then you're restricted, but you can lie on the sides. But the point is, after all this toil, you have a lot of muscle cramps, you will have a lot of back pain. So most of the people who say surgery made them have back pain, I don't know, post-spinal pain. It's not post-spinal. It has to do with your posture. So exercise will just help you to ease the muscles, because most of the back pain is because of muscle spasms. And most of us have had x-rays done and we've been told it's just muscle spasms. What is the solution? It's physiotherapy. But what is physiotherapy? It's exercise. So just try to move. Try to do some simple exercises. It doesn't matter how many times, how many days you are post-delivery, but move. Try to move your back. Try to maintain the correct posture, and that back pain will be gone. Those muscle cramps will be gone, and you'll be happy. I think this is something we can try, all of us.